Today in this lecture, we will talk about nephrogenic diabetes insipidus. As we were discussing the disorders of urine concentration, and we discussed that the disorders could be either due to increase or decrease formation or release of antidiuretic hormone, or due to no response to antidiuretic hormone, or due to disruption of the medullary interstitium. So nephrogenic diabetes insipidus is a condition in which the kidneys, especially the cortical and medullary collecting ducts in the nephron, will not respond to antidiuretic hormone. ADH, antidiuretic hormone, is being formed and it is being released, but which in central diabetes insipidus, in which it is not being formed or it is not being released. So as compared to central diabetes insipidus, in nephrogenic diabetes insipidus, it is being formed and it is being released, but it is unable to act in these levels in the medullary and the medullary and cortical collecting ducts. So it is not able to, the kidneys are not able to reabsorb water, so it also leads to formation of a lot of dilute urine. Now this is one condition which leads to disordered concentrating ability of the kidneys, or disorder of urine concentrating ability of the kidneys. So what are the causes of nephrogenic diabetes insipidus? The causes are generally due to genetical causes, metabolic causes, causes due to drugs, poisoning, or due to chronic kidney diseases. Now, some of these causes directly act on the receptors of the antidiuretic hormone, but the other causes are somehow disrupting the ability to reabsorb sodium or to maintain the hyperosmolar renal medulla. Now, the causes due to genetic reason include the mutation in vasopressin 2 mutation or aquaporin 2 mutation. Now, the V2 mutation, V2 receptor, the ADH, the receptor on which antidiuretic hormone acts here, and due to which the aquaporin 2 channel is inserted, those two mutations which disrupt the V2 receptor or the aquaporin 2, insertion of the aquaporin 2, or any abnormality in the insertion of aquaporin 2, so those conditions will lead to nephrogenic diabetes mellitus, because there will be abnormality in the receptor or the action of the receptors. Similarly, cystinosis is a condition in which there will be abnormal action or inability of the ADH to act properly and help in concentration of the urine. So these are genetic causes which will lead to nephrogenic diabetes insipidus. The metabolic causes which leads to nephrogenic diabetes insipidus include hypokalemia, low potassium, and hyperkalemia, high calcium. They will lead to nephrogenic diabetes insipidus. Now, the drugs which will lead to nephrogenic diabetes insipidus include lithium and tetracycline. Similarly, poisoning due to heavy metal can lead to nephrogenic diabetes insipidus, and chronic kidney conditions due to polycystic kidney disease and sickle cell disease and some infiltrative diseases like, for example, hemochromatosis, they may lead to nephrogenic diabetes insipidus. These are all the conditions which may either disrupt the receptor or do some abnormality, or bring some changes due to which the hyperosmolarity of the renal medulla cannot be maintained, and all of those changes will lead to a lot of dilute urine formation, and it will be diabetes insipidus. Now, it is different from the central diabetes insipidus. It is different from central DI, central diabetes insipidus, because in central DI, when we inject desmopressin, when we inject the synthetic ADH, desmopressin, the synthetic ADH, the desmopressin, when we inject it, it acts and it decreases the volume of urine, and it increases the concentration of urine. In nephrogenic diabetes insipidus, this desmopressin or the synthetic ADH, it will not be able to act here in the kidneys. It will not be act here in the kidneys because there may be some mutation in the receptors, or because of metabolic or causes or drugs. This in medullary interstitial hyperosmolarity may have been distorted, so the desmopressin may not be able to act. So even 2 hours after injection of the synthetic ADH or desmopressin, the concentrating ability of the kidneys or the urine concentration will not be restored, and the volume of urine that is formed will not be decreased. So it will give a clue about the cause of diabetes insipidus, and it will give a clue about the nephrogenic nature of the DI. So that's all about the nephrogenic diabetes insipidus, some important causes of nephrogenic diabetes insipidus, and how to differentiate it from central diabetes insipidus. Thanks a lot for watching the video.